What does a cyst smell like? This is probably one of the most frequently asked questions that I get asked after people watch a video of a really good cyst extraction like this one. Cysts actually don't really smell like much, especially if it's just a typical epidermoid cyst. The contents are just macerated skin, so if you can imagine what wet skin smells like, it really doesn't have a very strong odor. If it does have an odor, it usually means that the cyst is infected or that it's ruptured. If a cyst did rupture, meaning somehow the cyst got irritated and the contents are leaking out, then the smell is sometimes described as a rotten, cheesy, or egg-like, sulfur-like smell. If a cyst has gotten infected, then this can cause a really strong odor. And this is because bacteria is likely involved, and this is when it's the most strongest smelling. When a cyst gets infected, it starts to swell and turns red and warm, and this is going to be really painful and tender to touch. When a cyst is infected, it's usually going to cause yellow and green discharge, and this is probably the strongest of all smelling cysts, in not a good way. Have a strong odor, but as long as you don't go and put your nose in it or something, it doesn't really affect the patient or the medical staff that are helping to remove it. If you got a cyst or a bump that you feel is growing or starting to get painful, and certainly if there's an odor coming from it, do not try to pop this yourself. Please go and see your board certified dermatologist.